Dr. Perushki. Several years ago, I chaired this committee at which another neonatologist, Dr. Colleen Malloy, testified. She told this committee that babies born as young as 20 weeks post-fertilization are capable of feeling pain. What more could you tell us about that subject?
There is now quite a large body of literature that does indicate that the babies who are at 20 weeks, and actually as small as 16 and 12, depending on whose literature you're reading, react to what they call noxious stimuli, meaning there is a change in their physiology, both immediately. Heart rates change. The ability to take in oxygen saturations change. Long-term follow-up show that there's behavioral and other physical abilities. They have a procedural memory of what has happened that has been documented in a number of studies. These little guys feel stuff. And it is standard of care at the NICU, where my entire job is to help someone transition from fetal physiology through something closer to term. We take care for their painful procedures. We intentionally either diminish, avoid, or treat with pharmacology that we know keeps them safe, because the pain affects them. It affects their outcomes at the time of the procedure. It affects them long term. So it's just our standard of care. It's not a mystery. That's reality of what we do.
I would ask now Ms. Mosley and Ms. Stanek to respond to, we all know that abortion's a mostly charged topic, and it's one of those things that really divide along partisan lines. I think we would all agree, however, that infanticide is wrong. So this question, if a baby is born accidentally during an abortion procedure, one would hope that the abortion clinic automatically would render medical aid to the children. So could each of you tell us more about why a clinic might neglect to come to a newborn baby's rescue, and why the legislation that Senator Sasse has put in is important?
Thank you. As I stated in my testimony, there is no good reason for obstructing care for a helpless infant who, first of all, defied the odds and survived abortion. Shouldn't they be given the chance to defy the odds and have a life and be wanted by someone else? And the only reason I can think of for obstructing such care to a helpless infant child is either the legacy of eugenics, which is inherent in abortion, thinking that this child should not have been born at all, when we know that abortion targets African-American communities, so that more times than not of these infant lives who are born alive, they're African-American. Or there's something to be gained by the illegal harvesting of fetal parts. We already seen from the Center for Medical Progress videos that this is a financial incentive for some in the abortion industry and those who benefit from the abortion industry financially. So other than those two things, there can be no good reason for obstructing care for an innocent child who has already defied the odds and should be given a chance at life.
Ms. Stanek?
Yes, Yes, totally agree, and would just reiterate that the physician who is now deciding the life or death of the baby after the baby's been aborted is invested financially in that baby's death. And so I cannot think that the decision to let the baby live or not is objective.
Okay. I think I'll yield back my time and put another question in for answer in writing. Thank you.